We use ActiveCare devices depending on the doctor who orders them, but I've been here about 2.5 years. I'm certain that I have probably ordered or dispensed ActiveCare 2,000 times. The major benefits of using ActiveCare as DVT prophylaxis following hip surgery or knee surgery are there is no risk of bleeding from dangerous medications. There are medications that need to be monitored with blood tests once or twice a week. There are other medications where you get shots in the belly, which are also can be dangerous and cause bleeding, serious complications after surgery, seromas, hematomas, etc. I was aware that it almost eliminates the risk of bleeding in patients after surgery. I also know that it was smarter than sequential compressive devices in that it has sensors that help prevent clots. If I was to compare ActiveCare to the other current medications used to prevent DVTs, I would have to say that ActiveCare is superior in just about every facet. Any other medication that you take by mouth or intravenously or subcutaneously or intramuscular are going to have potential for side effects that are harmful and intolerable to patients. I have to say honestly, I've never had a complication using ActiveCare that was serious. I'm not aware of any other device that you can send somebody home on that has the proven efficacy of ActiveCare device. Well, as with anything, I think the patients, when they first encounter their ActiveCare device, they probably wonder, how am I going to get around like this? How am I going to stand up? And our therapists in the hospital are very good at assisting the patients, and they're very mobile. The pump goes right around their neck and can sit on their side like a satchel. It weighs, I don't even know if it weighs a pound. It's probably mostly unnoticeable. Using ActiveCare in the hospital is very convenient. We have a pretty good system where they're placed in the operating room before any bandages. If it's a knee, they get placed. You can use it under a bandage. And once they're on, I think they're pretty much, it's a non-issue. You unplug them when you want to rest, and they get plugged back in. Probably the tech or the nurse might have to assist a patient in doing it so that they can maintain hip precautions. But once they get hooked up, it's pretty much no hassle. The nurses don't have to wait for pharmacy to send the medication, so they're not waiting for that. It's simple in the room, and we get very good support from the representatives. We have a very good compliance rate here. Once we educate the patient as to why they're wearing it and what they don't have to do. Some people don't like to give themselves shots. And once they're educated as to the value and the benefits of ActiveCare, most people pretty much keep it on. Comparing ActiveCare to other SCDs, if a patient needs to get out of bed and use the bathroom, all they have to do is put the pump around their neck and they're mobile. I recommend ActiveCare devices as my #1 choice for postoperative DVT prophylaxis. I think it's wise for any hospital to use ActiveCare devices. It's got a proven safety record. There's a new study out that shows its efficacy It has no dangerous side effects and is all around good choice for patients. Patients don't need to go to the pharmacy. There's no reason to go to a lab to get blood drawn. It's just an all-around convenient choice